I will keep my comments to 10 minutes, especially if you'd be kind enough to inform me when the 10 minutes have expired. I want to speak about an epidemic that every one of us knows is raging across every one of our states. It is absolutely the case in the Commonwealth of Pennsylvania, and it is the heroin and opioid epidemic. This is excruciating to so many families. I think at this point we all know people who have been victims of this epidemic. I certainly do. And we have to be doing all that we can about this. I have the privilege of being the chairman of the Health Subcommittee on the Finance Committee. And in that capacity, I've tried to learn what I can about this epidemic. I've traveled all across Pennsylvania, hosting roundtable discussions, field hearings, getting as much input as I can. Mr. President, what I've learned is that there's at least 3 things that we could be doing here in Congress to at least help address this terrible epidemic of opioid and prescription drug abuse. None of them are a silver bullet that are going to end this epidemic, but they can help, and we need to be doing what we can to help. Number 1, we can reduce the diversion of these powerful prescription narcotics, and there are ways we can do that. Number 2, we can deal with overprescribing because that's a problem. And number 3, we can improve access to and the quality of treatment for people who are already addicted. Mr. President, we've got an opportunity to make progress on all 3 of these really important areas if we will just approve the conference report on the Comprehensive Addiction and Recovery Act. We know it as CARA, the Comprehensive Addiction and Recovery Act, that we will be voting on soon. Let me run through quickly how this bill helps on all 3 of these areas. Number 1, I mentioned reducing the diversion of powerful narcotics. The Government Accountability Office estimated that in a single year, 170,000 Medicare beneficiaries were doctor shopping. That is to say, they were going to multiple doctors, getting multiple prescriptions, getting them all filled at multiple pharmacies, and ending up with a commercial scale quantity of these powerful addictive narcotics. 170,000, that's a tiny percentage of Medicare beneficiaries, but it's a big number. Well, when Medicaid and when commercial insurers discover that there are people in their plans that are doctor shopping, they have a device to stop it. It's called lock-in. What they do is when they discover a person is doctor shopping, they require that person to get their prescription from a single doctor in a single pharmacy so that they can't continue the abuse. This tool does not exist in Medicare. And so I sat down with Senators Brown and Senator Portman and Senator Kaine, and we wrote a bill that would give Medicare the power that Medicaid already has, that private insurers already use, that would allow Medicare to lock in a patient to a single prescriber and a single pharmacy when they discover doctor shopping. Mr. President, this has broad bipartisan support. The President called for this legislation in his budget. The Pew Charitable Trust, there's law enforcement support, doctors, seniors groups all support this. It would help stop fraud. It'll help coordinate care. It'll reduce cost. But most importantly, Mr. President, it's going to save lives. It's going to reduce the diversion of addictive narcotics onto the streets, and that's something we can do. This bill that Senators Brown and myself and Portman and Kaine that we wrote, it's in CARA. It's in this legislation. It's a good thing. Secondly, I mentioned reducing overprescribing. The Center for Disease Control has found that we are in fact overprescribing opioids for many medical conditions, and doctors don't always know about this when they are seeing a patient. They don't know that maybe there's another doctor providing maybe similar, maybe equivalent prescriptions. And so there's a mechanism, an electronic database system that would allow physicians to know what a patient has already been prescribed so that they wouldn't create an excessive or an inappropriate prescription. It's called a Prescription Drug Monitoring Program, or a PDMP, to provide that information, a patient's history. Senator Shaheen was the lead on a bill. I joined her with this, as did Senator Collins, to provide assistance to states to make sure that their prescription drug monitoring programs are interoperable across state lines. This is a tool that will help reduce the overprescription, end up making sure we have better care, and diminish the incidence of these narcotics getting into the wrong hands. Finally, Mr. President, I mentioned that we need to improve access to and quality of treatment. The CARA bill, this legislation does that in a number of ways. It would establish a demonstration program for evidence-based treatment programs. It'll help connect individuals battling addiction with services. It expands access to naloxone or Narcan. That is a drug that immediately reverses the effects of the overdose and saves lives. CARA will help law enforcement set up heroin task force, and it'll increase opioid drug disposal sites. So, Mr. President, there's a lot here. This is very constructive. The bill has enormous, broad, bipartisan support. CARA passed in the Senate 94-1. It passed in the House 400-5. The conference report that we'll be considering here is substantively the same as the bill that passed the Senate. In fact, it's broader. It does more to help dealing with this terrible problem. It's got the support of all kinds of public health groups. It's got Democrat and Republican ideas. It's exactly the kind of thing we ought to be coming together and get done. I just want to urge my colleagues, let's don't play politics with this one. You know what, I know it's the political season. I know there's a temptation. It's happened with other pieces of legislation. But this one's too important for this. There is broad bipartisan support. This is constructive. It won't end the epidemic, but it will save individual lives. It will help us make progress for the people that we represent. So I hope that very soon we will approve this conference report and get this over to the House so that they can approve it and get it to the President's desk. I'm sure the President will sign it. And that's exactly what we need to do. And with that, I yield the floor.